Hey everyone, Dr. Mitchell here. What are we going to talk about today? I've got another positive ANA consult to share with you in an elderly male with a rash and changing renal function or kidney function markers. But before we get into that, got to preface this by saying I'm still a little bit under the weather here, and you could probably tell by my voice. Whatever was invited into the sandbox to play this year was extra mean, nasty, and virulent. You know, sort of like the type of bully that smacks the glasses off of the face of the nerds and like stomps them to break them, steals the lunch money, and will steal the ho-hos that have been so neatly wrapped in foil by your mother that you enjoy with your chocolate milk carton at recess. And yeah, it was mean, but I'm starting to feel better. Anyways, let's get into this case. So as I said, positive ANA consult in an old male, changing renal function markers, and a new rash. So what's been going on with him? This last year has been particularly stressful for him. He's been traveling very frequently to visit family for good reasons, fortunately, awesome, but it has been taking a toll on his body. And the wheels kind of fell off this past winter, it seems. Late November, he went on a hike with his son and had this skin outbreak over his forehead, over his nose here, across his cheeks, sparing these parts of his nose here. We call that the nasolabial fold. Very peculiar type of manifestation that we see in diseases like lupus. He had a little bit here at the bottom of his neck and the top of his chest. Also really common to see rashes there in patients with autoimmune disease, and also going down his right arm with a little bit of this flaking and scaling. And so he saw one provider who said, "You just got too much sun. Put some aloe on it, it's a sunburn." And then he saw some of his other care providers who said, this looks a little bit more peculiar than sunburn. And they ordered an ANA and a smattery of other studies, which revealed a positive ANA, 11280 pattern, who cares? And so he was referred to me by another of his naturopaths, a really good friend of mine who's a thyroid expert, and was like, what do we do with this? And so outside of this recent stressor, some of his other history, no family history of autoimmune disease, lupus, arthritis, anything like that. No history of anything like this occurring in him in the past. He does have a childhood history of atopic disease, allergic rhinitis, asthma, and eczema. He grew out of the eczema. Asthma persists. So he's got some immune dysregulation, or has been having some immune dysregulation going on. He also has a thyroid disease, which again, this other naturopath friend of mine is managing. And if you've heard me talk about in other videos, thyroid disease in developed countries is essentially autoimmune thyroid disease. We don't have iodine deficiency here. There's really no other reason for it. His is, I don't know. I didn't talk to the other doctor and figure out what was really going on there, but I consider thyroid disease kind of a loose criterion that increases my sensitivity in considering autoimmune disease. Let's see what else here. Not a lot else going on when I talk to him. No joint pains, no oral ulcers, no hair loss, no GI stuff. Renal, kidney. So along with the studies that his primary care ran, who discovered the ANA, there was another metric done late in December, which kind of gave me a sense of his baseline renal function. And then when they checked it again in first week of January, his glomerular filtration rate, which pops these two markers, glomerular filtration rate and serum creatinine, are on your comprehensive metabolic profile that you usually have at least done once a year if you're good about keeping up with your health stuff. Hopefully you are. These are markers of kidney function. And so from his first metric to his second metric over the course of 2 weeks, the glomerular filtration rate had dropped 20 points and his serum creatinine had increased half a point. And so when I saw that, I kind of became alarmed a little bit, and my sphincter slammed shut, because if you know anything about lupus in old men, it can be particularly nasty, and it can lead to dialysis, kidney failure, and death. And so little bit difficult to interpret in this case because he also did have a cold, viral infection, whatever that happened late December, and it's very possible that these changes could just be secondary to some dehydration that he experienced from the infection. But he didn't have any symptoms of renal disease, so I felt like my sphincters didn't have to be slammed so tightly shut after a full night's sleep brooding on this case. So what are we going to do with him now? His naturopath pulled the trigger on 15 milligrams of prednisone, which I don't think was unreasonable at all, seeing those renal function changes and this rash and this positive ANA. We stopped that. We're going to send him in for a skin biopsy to see if there's anything immunologic going on in his skin that's characteristic of lupus. I don't think this is lupus, to be honest. I think he has an ANA associated with his thyroid disease. I don't know what the rash is at this point, but it's definitely not sunburn, so whoever that other clinician was should slap himself upside the head. And we'll leave it at that. But yeah, we'll see what the skin biopsy results say. I repeated some serologies on him just to see if he's going to have an ANA again, and a double-stranded DNA, which is highly specific for lupus, particularly renal disease. I already got his complements back. Complements are markers. They're proteins that your liver creates and are low when we suspect inflammation is going on, and they are also somewhat specific for renal disease, but not terribly. And I got markers of his kidney function back, so I'm relaxing a little bit because they seem to have gone back up 20 points in his GFR respectively, and his creatinine seems to have returned to normal, so I'm resting a little bit easier there. And I don't think this is lupus, but we'll see what those skin biopsy results say, and maybe I'll do a repeat video on this one just to let you know how things have developed. But moral of this story, ANA is very sensitive, not very specific. Thyroid disease can be associated with positive ANAs, and lupus, renal disease in old guys, can be really mean and nasty. So grandpa, friend's grandpa, your father, whoever, if this goes on, make sure that they get in as soon as possible and evaluated, and that these sorts of things are looked at. Alright, I've been talking too long here, trying to make these videos shorter. I gotta go eat lunch. This is Dr. Mitchell signing off. I hope everybody has a great day, and we'll talk again real soon. Bye-bye now.